Good morning.
Good morning, Sonia.
Great job this week at C100. Got great reviews.
Thank you. Thank you. Thank you. It was great to be there. Almost felt normal.
I know, right? Well, they had 24 people in person and 36 online. I was online.
Nice to hear that from our secret shopper, right, Terry?
Yeah.
Well, even this call feels like it's
Yes. Hey, Don.
And I see the commissioner and Andrew
Yes.
and Jimmy. Hi, Jimmy.
Hello, Miss Sonia.
How you doing?
I'm good. I am well. Thank you. Thank you.
Thank you, God. Praise be the Lord.
Commissioner, no doesn't mean no. It means just not right now. I'm taking it.
That's exact. No never means no. That just means we have to realign our approach, right? You're a military man. You understand, right? No doesn't mean no, right? We're going to find another way. Another way.
Applicable on us. That's applicable on sales calls as well.
That's right. That's right. But, you know, we do have one. You know, I think we're on a roll with that Lake Providence facility that y'all working with us on. So that's all good. I got approval from LAFA to move forward. And now I'm waiting on the city of Lake Providence. And so we're going to push that forward and get that project in motion. So that's all good. That's all
Exciting.
good. It is. It's very, very good. And it meets right in with everything that we are doing. All right. So, yes, we've already sent a missive to the White House on the funding for NOCS. Right. So we just need to light another fire.
All right, Andrew, why don't you kick us off so that we're ready when the governor is ready to make his.
Good morning. I'm Andrew Dawson. I'm honored to serve as the director of the Resilient Louisiana Commission. Welcome to this Friday, November 20th meeting of the commission. It is now called to order. I'd like to thank all the commission members once again for taking part. I'd also like to welcome members of the public. The public's attention and involvement is crucial to the success of the commission. The Resilient Louisiana Commission appreciates the invaluable input from residents across the state and industry sectors. We welcome your continued participation and insight. This meeting is available via video conference, and members of the public are encouraged to provide comments at resilientlouisiana@la.gov. The public can sign up for meeting email alerts and access Resilient Louisiana Commission and Task Force meeting schedules, agendas, minutes, audio recordings, reports, and other documents of interest at opportunitylouisiana.com/Resilient Louisiana. This point, we'll conduct a roll call. First, I'd like to recognize that I do see the following commission members present: Secretary Pearson, Terry Sterling, Lieutenant Governor Nungesser, Bill Hogan, Sonia Perez, Tim Temple. Let me see if I've missed anybody else. Is Secretary Kimberly Lewis Robinson here?
I'm here.
Thank you. Commissioner Darden? Dr. Jim Richardson?
Here.
Thank you. Representative Paula Davis? Senator Ronnie Johns? Scott Henskins? Michael Lafitte? Walt Leger?
Michael Lafitte is here.
Thank you, Mr. Lafitte. Walt Leger? T. Martin? Tyron Picard? Louis Wren? Jade Brown Russell?
Hi, I'm here.
Wonderful. That puts us at 11 members currently present. Surely others will be joining, but that gives us a quorum. In accordance with revised statute 4217.1 and the current public health emergency order as declared by Governor John Bell Edwards' executive orders, this meeting, as being held via video conference and in a manner that allows for observation and input by members of the public, as set forth in the public notice posted yesterday morning before 10 a.m., this shall serve as certification of the inability for the Resilient Louisiana Commission to otherwise operate in accordance with the Louisiana Open Meetings Law due to such a meeting being detrimental to the health, safety, and or welfare of RLC members and the public as a result of the public health emergency. The RLC will provide for attendance at its essential meeting today via video conference because it is unable to obtain a quorum. Now, if everyone could please mute themselves for the remainder of the meeting. And if you want to note if you've just joined the call and you're a member of the commission, if you want to chat on the side to let me know that you're in attendance, that'd be great. But without further ado, I'd like to introduce our two co-chairs, Secretary of Economic Development, Don Pearson, and Healthcare Management Advisory Consultant, Terry Sterling.
Thanks everyone for joining us this morning. And Terry, I'll pass over to you.
Yes, good morning, and it's great to see everybody's faces, and we appreciate your continued leadership through the challenges of the pandemic.
All right, gang. Well, I think we're ready to go. We have a special guest this morning, and very pleased to have Governor John Bel Edwards joining us. And Governor, we know you've got a busy day, so we'd like to invite you to lead off our meeting and address our organization.
Thank you, Don, and thank you, Terry, for your leadership. I appreciate everybody who has served on the commission, all the individuals on the various task forces and other folks who have informed the deliberations and the recommendations that have come forth. As you all know, in April, I created the Resilient Louisiana Commission because the COVID-19 public health emergency had hit us the month before. And the charge to the commission was to determine how do we make the state of Louisiana more resilient in the face of COVID-19 and other crises. Didn't know at the time that we would actually have 3 hurricanes make landfall later in 2019. And many other tropical storms and hurricanes actually impacted us. So it has been a very difficult year for the state of Louisiana, for everybody, whether you're young or old, whether you're in business, whether you're an employee, it doesn't matter. It's just been a tough year. And so your work has never, is extremely important, is what I was trying to say. And so the charge really was to figure out what recommendations you all would make for reopening the economy safely. And secondly, what are your recommendations for making Louisiana more resilient in the long term? So we had a short term and a long term focus to your work. I know that the challenge is complex but it's also critical to our future. I know that even absent COVID and these hurricanes, we've always been challenged, and like every state, I suspect, but probably more than our fair share of challenges of things that we've needed to address for a very long time. In May, the commission produced the first report with preliminary recommendations for reopening Louisiana's economy. Obviously was based on health science and the data that we had available to us, public health recommendations from various experts. And I want you to know that that first RLC report absolutely informed our decision-making on reopening Louisiana's economy. It's a very difficult thing to do, but what we've always tried to do is to strike the right balance between protecting public health on the one hand, and then having our economy open to the maximum degree possible, consistent with the public health imperative, for the benefit of businesses and industry and employees and for the benefit of the state. And no matter where you strike that balance, reasonable people can say, well, you should have been on this side a little bit more, or on that side a little bit more. But I think overall, we've done a very good job, and we've adjusted over time as the situation has allowed and as we learned more. This was a novel coronavirus. It's new. The medical community, the scientists, they didn't know much about it. Still, there's an awful lot that we don't know, but we have learned a great deal since April. As we continue in phase 3, I have now received the Commission's report of long-term recommendations. And so this is a comprehensive game plan for a more resilient Louisiana. And this is where I really want to express my deepest gratitude and appreciation for the work. More than 300 citizen leaders serving on the Commission and its 15 task forces, covering every sector of life in Louisiana, and many more citizens contributed their thoughts, their time, their effort to inform this report. And I encourage the general public, elected officials, the private sector, really everybody, to join me in embracing the spirit of the report and acting upon its best recommendations. And some of those recommendations can be implemented with policy changes. Some are going to require legislation. Some of that legislation will be easier than other areas, and I guess that should come as no surprise. But that's where we are today. Is we're going to try to distill this down, because, as you all know, it's a very lengthy report with lots of ideas. Try to figure out the best recommendations, categorize those as whether they can be implemented through executive action, through legislation, or other ways, and then get about doing these things. Now, as for next steps, let me say that I view this document as the people's report about how we can make our state safer, stronger, and better equipped to bounce back from challenges. I say that because of the diverse citizen-led work really from all across Louisiana that has gone into formulating this game plan. Literally examined every sector of our economy, and they've dedicated their expertise and passion to this effort over the past 8 months. I think if you look at the Commission, we have tremendous diversity, whether it's geographic diversity, gender diversity, or racial diversity, the diversity of thought that comes from having public sector people, private sector folks, you name it, every sector of the economy being involved. And so we can rest assured that the viewpoints and interests of Louisiana citizens overall have been considered and are contained in these recommendations. Now, resilient means that we have the capacity to bounce back quickly, and I absolutely believe that. And inherent in that bounce back is the sense, the goal, the determination that we're going to be better than we've ever been. We're going to be stronger. It's not going to be automatic, and we're going to have to be deliberate and intentional. We're going to have to be focused and committed to doing this. But I am very optimistic that we can make this happen. We didn't know when our COVID-19 response started that we were going to have historic challenges from Hurricanes Laura and Delta and Zeta. And a lot of people missed this because it happened. A lot of people, especially across the country, missed it because of the way the national election was playing out. That was kind of consuming all the oxygen in the room, right? But Hurricane Laura at the very end of August is the strongest storm to ever make landfall in Louisiana, or at least since 1856, the fourth strongest ever to make landfall in the continental United States. So never has resiliency been more important for our state, our people, our future. We're going to continue to recover across Louisiana, especially in Southwest Louisiana. We're going to be learning new lessons about resiliency every single day. But from the Commission report, I do want to highlight some hallmarks of this effort to build a more resilient state. Number one, broad public input has established that this effort is one that all Louisianans can own and hopefully embrace. Number two, equity is essential. Our state succeeds when the full access and opportunity reach every person in Louisiana, no matter their race, gender, age, or background. And we really need to make sure that we have equality of opportunity. And look, we can't guarantee equality of outcomes, but we should be about making sure there's equality of opportunity. Economic diversification is critical to building and maintaining a resilient state so that Louisiana is not overly reliant on a single industry or one or two or three, but really across the many industries and sectors of the economy. Fourth, Louisiana will capitalize on our sources of economic strength. And there are some things that we can do to look at the future, anticipate where the world economy is going, the U.S. economy, and what we have to do now to be successful in competing on the global stage. The recommendations in the report fall under 6 overarching categories. Those are equity, inclusion, and quality of life. Also, digital access and physical infrastructure. Third is access and opportunity in education. Related to that is number 4, workforce development and continuing education. Fifth is small business and entrepreneurship. And number 6 is government support. I look forward to sharing more in the near future about how we can take action to make Louisiana an even greater and more resilient state. And I want to again thank all of you for your work. I will tell you that your work is not finished as a commission, as task forces. For one, COVID-19 is still very much with us. I do know that you're going to get an update on that. I want to say, as governor, that I appreciate the work that you all have done as we have tried to lead by example and make sure that Louisiana citizens across the state take this pandemic seriously, understand the role that they have to play in order to protect themselves and their families and their communities. And I know that after 8 months or so, COVID fatigue is real, but that doesn't mean the virus is going to leave us. In fact, it's just to the contrary. We're now well into our 3rd surge, a surge that, if you look across the country, could be and likely will be worse than the first or the second in terms of positivity, case growth, hospitalizations, and yes, unfortunately, deaths. And that's despite the fact that we have made tremendous improvements in the way the medical community cares for victims of COVID-19. The overall mortality rate is down, but if you have enough people get sick, the fact that fewer of them will die doesn't mean that you won't have more deaths overall. And this is despite the fact that we now have therapeutic treatments, both for those who don't need hospitalizations and those who do. We've made advances on the use of mechanical ventilators and other breathing devices and so forth. And as we look forward, we can be optimistic that that soon we will have at least 1 and probably 2 vaccines that we can begin to administer. Pfizer announced that today they will be seeking emergency use authorization of its vaccine from the FDA. And then we will have the advisory committee that will issue its guidance on who should be and should not be vaccinated with that particular vaccine. We know from General Perna and Operation Warp Speed that we will start receiving the vaccine in state a couple of days after the EUA is authorized, or at least that's the plan. And so I think we can all assume that some point in December, next month, probably in the second half of the month, we will start receiving our allocation and start administering the vaccine first to healthcare workers and then secondly to individuals in nursing homes and assisted living centers and so forth. And that's all positive. I do want you to know that the number of vaccines we're going to have available is going to be relatively limited at first, just because the production isn't where we would want it to be, not because of anybody's fault. This is the fastest the vaccine will have ever been brought to bear. But what I'm trying to let people know is our fight is not over when we start administering this vaccine. We're going to be months and months and months trying to administer this vaccine broadly enough across the state so that we can achieve the herd immunity that we're looking for and finally begin to put this crisis, this public health emergency in our rearview mirror. And between now and then, we have to do what the Vice President asked us to do on Monday, joined by Secretary Azar, Dr. Redfield of the CDC, Dr. Birx, Dr. Fauci, and that is we have to bridge to the vaccine. And when you have this unprecedented surge, that means we have to adhere to those things that we know work. We have to look at the mitigation measures. We have to make sure that the restrictions allow people to achieve the physical distancing that's required to reduce transmission. Wearing masks is critically important. And we now know it confers a benefit on the mask wearer, not just those who are in close proximity to the mask wearer. Staying home when we're sick, washing our hands, protecting the most vulnerable, getting flu shots, all of this really, really important. And so we're asking all of you to embrace this, make sure that every sector of our economy, every one of these task forces, that we continue to message this, because the longer the public health emergency goes on, the more people really engage in fatigue. We still have some people who are minimizing the danger posed by this disease. We have some people who deny it outright. But ultimately, we have to be responsible leaders and strike the right balance. That's what we're trying to do. Finally, before we get to questions and answers, in less than a week, we're going to have Thanksgiving. You may have seen that the CDC came out yesterday and advised against traveling for Thanksgiving. That should tell you all you need to know about this current surge and the threat to public health that it poses. Secondly, it's not just traveling. Nobody's Thanksgiving, and by the way, I'll just go ahead and say it, nobody's Christmas this year should look like they have looked in the past. We're multi-generational family members joined together at the same table in the same households for various holiday-related activities. That is a very dangerous thing to do in light of this surge. And so I'm encouraging everybody to have the patience and the discipline necessary and to understand that just because someone is your very, very close friend or relative, if they don't live in that same household with you, there is a very real danger. And the danger is more real, more pronounced today than it was before, because the community spread is so much higher, as evidenced by the increasing positivity rates. And we have added more than 250 net new hospitalizations across the state just this week. And so we're on a trajectory right now that, quite frankly, we've got to get off of it. If people would distance and wear their masks, we know that it will work. So I'm asking for your help on that. And I want to complete my prepared remarks by going back and thanking Don and Terry for their leadership. Thank all of you for your work. And then I'm going to make a commitment to you all that this work that you all are submitting with this report, we will implement as much of this as we can, as quickly as we can, so that we do achieve the desired result of building a more resilient, more prosperous Louisiana for everybody. So with that, Don and Terry, I'm going to stop, and I think the program may call for some question and answer. I'm not sure, but I can be with you all for a little bit longer.
Floor is open if there's any of the commission that would like to make a comment or ask a question. The governor's here.
Hey, Don, I'll throw one question out there. Governor, I was up in Washington, D.C. last week at our office up there, and it struck me that unlike 2005, when I was up there after Katrina and Rita, and many people asked me, well, how's Louisiana doing? How's New Orleans doing? How's the recovery coming along? I didn't have anybody in Washington who asked me how Louisiana or Lake Charles was doing post hurricane, and it concerned me. And I know, aside from the sheriff of Tangipahoa Parish, you also have the phone number of the president-elect, and so I'm hoping that those needs are being communicated on the hurricane recovery front, because truly, for those who haven't been to Lake Charles, it's far, far worse than anything I saw after Hurricane Rita.
Yeah, well, Tyron, you're exactly right. And unfortunately, this happened to us in 2016 too. It was the last presidential election year. We had those really nasty floods in August.
Right.
And the nation wasn't paying attention. And that happened again this year. The storm actually hit Lake Charles during the Republican National Convention. So you know where the nation's attention was, and it wasn't on the storm. And so now we have to go and direct everybody's attention back to Louisiana, principally to Southwest Louisiana because of Laura, although Delta certainly didn't help anything. And I am working with the congressional delegation. I'll be sending a letter today to the president outlining what our requests are out of a lame duck Congress, if they can pass an appropriation, for example, for CDBG and hazard mitigation dollars and those sorts of things. But also there's some simple things that we're asking for, in terms of getting to a 90-10 call share, which would be very, very helpful because we had multiple storms hit the same area. A 25% call share can be really, really tough to deal with. And there's a lot of things that we're asking for. And then we will, I have already talked to the president-elect, and he's offered to meet with me during his transition so that I can give to him and to his team what our needs are. And trust me, that meeting is going to start with a reminder of exactly what we experienced, because people in Washington don't know. And so we're going to do that. And I'm trying to schedule that meeting now. And hopefully it'll be scheduled for the very near future. I do think it will help to have Cedric Richmond in the White House, because I know that in addition to the president, that I'll have somebody there who understands our issues, takes the calls, and then presents information to the president on a timely basis.
Great. Thank you.
Any others?
Sure. I'd love to just ask if there's anything contemplated, and this is such a tough situation, and certainly hard for all businesses to plan, restaurants included. Any changes to occupancy levels or whatnot, restrictions? Just tough to plan.
Well, T, I'm not prepared to make an announcement today. We have meetings literally every day. I have one later this afternoon where we look at the data again. We look at what's being recommended from the CDC and what other states are doing that seem to be effective, and things that we think we should do here in Louisiana. And so right now, I'm asking people to focus on doing those things that are in the current proclamation, of enforcing those restrictions and making sure the mask mandate is followed. Because quite frankly, if we would do those things, if we could get much more compliance with the things that are already in place, we would greatly slow the rate of growth in our cases, and obviously reduce the number of hospitalizations and deaths as well. But it may be, and I've always said that before we lose the capacity in our hospitals to deliver life-saving care, we will move backwards and impose restrictions that we previously have imposed. So that may be where we're headed, but I'm not announcing anything today, and we're still studying the matter. I do want to tell you all that if you remember, we had our first surge, and then we responded to it with a shelter-at-home order. Even though it was a shelter-at-home order, we fully embraced all of the essential businesses that was recommended to us from the federal government. We never closed non-essential retail like most states did. We kept open manufacturing and construction without any limitations and so forth and so on. But we went to a stay-at-home order. It worked. We then went to phase one and so forth. And then we had that second surge. We got back on top of things again without going back to the stay-at-home order. And so I have no intention of going, all the way back to the most restrictive things that we've done. But there may be some changes that we need to make. I'm just going to ask everybody to focus on the restrictions that are currently in place. I have no doubt that if we could actually get more adherence to the current mitigation and people to follow the current restrictions, we wouldn't need to do anything else. The thing we have to decide is that possible? Or do we have to go ahead in order to get people to pay attention again? Do we have to go back and do more restrictions and so forth? And we're going to be taking a look at that. The current proclamation expires on December the 4th. And so one of the things I'm trying to figure out is, do we need to act before then in some way, or can we wait till the 4th? And then we have to figure out what that action looks like. But I'm not prepared this morning to make any announcements, T. I'm sorry.
And I'm not pushing you to do that. I'm just going to quickly share with you. We never even went to the 75% that's allowed. We're something less than 60 at one little restaurant in New Orleans. But and we take everybody's temperature, including the guests. And I want to tell you something. We have not had any pushback on that. We have had people thanking us. So I'm just sharing that.
Well, and look, this is something that I hope you all realize. Consumer behavior, 80% of it is not driven by any restrictions or things that are imposed by government, not here in Louisiana or elsewhere. 80% of consumer behavior is driven by the virus and what it looks like in the community. Are the number of cases growing? Is positivity increasing? Are people increasingly being hospitalized? What's the death rate? And I can illustrate that really simply for you. 1 year after we won the national championship at LSU, I think it was less than 25% of the season ticket holders renewed their season tickets for this year. And so if we want the economy to be all that we want it to be, we really have to get past the virus. And in the meantime, we have to strike the right balance because at the end of the day, does anybody believe that if I didn't have a proclamation in place, all of a sudden New Orleans is going to be flooded with conventions and tourists? That's not going to happen. I pray that it happens sooner than later. The vaccine is going to be a big part of that, and I can't tell you exactly when, but it isn't the restrictions that are doing that. It's consumer confidence, and I think you can look at Sweden. Sweden took an exact opposite approach from most countries, including Louisiana, but its neighboring countries. Its economy is contracted about the same as its neighbors, even though it didn't do the lockdowns. The only thing it has to show for it is more deaths. So anyway, that's a long answer to a simple question, T. And by the way, I haven't been to your restaurant since March, and I'm looking very much forward to getting back to Commander's Palace, and not to play favorites, but it happens to be one of my favorite places in the world to go eat.
Well, I'm gonna take your temperature when you come, okay?
Well, please do. Hey, look, they take it when I go home, and they take it when I come to the Capitol too. So it's a simple thing to do.
We look forward.
Hey, Governor, I traveled from North Louisiana down to New Orleans and back this week, and I did see some things that kind of bothered me. Somebody mentioned to me possibly maybe getting some leaders in the medical community to would it be a chance of them maybe doing a PSA or something to try to give you some cover in the light of the political climate we're in right now and what just recently happened with the legislature with a resolution?
Yeah,
Maybe,
and
you
look,
know, some high profile medical people in each community doing a PSA about
well,
wearing masks.
we're working on that to try to broaden the outreach and make it more effective. And quite frankly, how there is a partisan element to a public health emergency.
I totally agree.
And it just boggles my mind because what we have tried to do, and we've been very faithful to this effort, is we have worked with the federal government and the vice president who's been leading the White House Coronavirus Task Force to implement the measures that they are recommending for Louisiana, and they have state-specific recommendations every single week. And that's what we've been trying to do here. And every time I've deviated from those, they have to be less restrictive rather than being more restrictive. But for there to be a partisan element, I'm just totally confounded by that. It doesn't make sense, but it is the reality of where we are. Just yesterday, I had a Zoom call, much like this one. And it was with every region in the state. We were talking to hospitals and medical directors and CEOs and the Office of Public Health regional medical directors as well. And I implored every single one of them to do exactly what you just asked, to get on talk radio, to get on the TV news, to do whatever they could to make sure that people understand that this surge is very, very real, and the trajectory that we're on right now puts us in a very grim place in short order if we don't do something. And I want to remind everybody, the way this pandemic works, if we changed our behavior today and 100% of Louisiana does everything that we're asking, nothing changes for 2 weeks. Because whatever is going to happen over the next 2 weeks in terms of cases and hospitalizations, that's already baked in.
Already done.
Because that's how long it takes for this transmission to result in cases and hospitalizations. But we would start seeing the benefit very shortly thereafter. That's why it's important. The other thing I want to remind you all of is just the nature of a pandemic, and it's particularly of this one. If anybody waits to act until the data says it is time to act, you have waited too long, because you're always worse off than the data shows when that data is moving in the wrong direction. As soon as your positivity starts going up, as soon as your cases start growing at an accelerated pace, you are much worse off than you realize because things don't increase day to day by a uniform amount. The increases get to be exponential. And when you combine that with the fact that you have to act 2 to 3 weeks ahead of when you lose your capacity, that's what makes things challenging. And so sometimes you actually have to make decisions at a point in time when people look around and they don't think the situation is as dire as it is. And that's why you have to respect science, and you have to respect those epidemiologists whose life work, who've been educated, their experience is all about these issues. And quite frankly, you have to tune out other people. That's just the nature of things.
Governor, I just want to say thank you. We are so close.
Oh, Sonia, that's you. Okay, got it.
Okay, thank you. We are so close to having a vaccine. We are so close to getting on the other side of this pandemic. Thank you for your continued attention and for all the great use of social media that you've made out of the situation. To let our guard down at this point would be truly tragic. So thank you for everything that you've done to keep it top of mind for all of us.
Thank you. And I firmly believe the worst thing we can do for our economy is to let our guard down. The absolute worst thing we can do for our economy is to let our guard down. So thank you, Sonia. And I just looked at the clock, and I think I have put the meeting behind schedule because I've stayed longer than I was supposed to. But I do want to thank all of you for your work. I want to wish you a very wonderful Thanksgiving. I'm going to encourage you again to be very safe over Thanksgiving, over Christmas. and encourage you now to be thinking about ways to have a celebration with family, but that is safe, and that may mean doing something similar to what we're doing today. Anyway, God bless y'all. Thank you so much, and I will continue to work very, very hard to implement the recommendations that you all have made, and I hope you will have a great rest of the meeting. So thank all of you very much.
Thank you,
Governor,
Governor.
thank you for your time today, Governor, and your leadership, of course. This commission will stay task dedicated. We're going to be responsive to the messaging that you've shared with us today, messaging about caution and compliance, and all of us will stay dedicated to that task as well. All right, folks, we will now call on some other special guests that we have today with us. And I think we can lead off with Dr. Cade Brumley with a K-12 update, please.
Thanks, Mr. Pearson, and thank you for having me here this morning. As I look across the screen, I'm just so impressed with the members of the commission. And just so you're aware, we too have relied on the work of the commission to help us better understand not just what we should be doing educationally, but what is happening across other sectors of our state. So thank you for your thoughtful and timely work. You know, I share this analogy from time to time, and I think it makes sense, or it made sense to me at least. Some people never thought we would get the school year off the ground at the beginning of the year, and so I've shared it's a bit like a cross-country flight, and the plane is off the ground. At times we have to reroute. At times we have to make unexpected stops, but we continue to ship the cargo across the country. And our schools have done a really good job of trying to make sure that as we've worked alongside our medical experts, that we're able to keep our kids and our employees safe, but also to provide some level of an educational experience to prevent children from learning loss that will impact them for their entire lifetime. And so I have been so impressed with our leaders and our teachers in the work that they have been doing over the course of the year. I do have a couple of slides. I don't know if they're ready to be teed up, but I did want to share first the modality of instruction that we have across the state. Right now, we have about 50% of our students across the state that are in fully face-to-face instruction. So across our state, 800,000 students, about 50% of our kids are in full face-to-face instruction, you know, and that's a combination of students who are in a traditional public system, one of our charter systems, or our non-public schools. So about 50% are fully face-to-face today. We have about 20% that are in a hybrid model, meaning that students are spending some combination of time either in face-to-face instruction or in a virtual model. And finally, we have, you know, roughly 30% of our students that are fully virtual. We have a few systems right now that are fully virtual, but the majority of students that are represented there in that fully virtual are students whose families feel more comfortable being fully virtual and not be back in full face-to-face brick and mortar instruction at the school level. We set up from the state level, we set up the framework where schools had minimum standards that they had to meet in terms of safety in order to operate. And then from those standards, they would go in and make their own plans on how they would operate. We asked that every system build out a fully virtual model. We also asked every system to build out an educational plan based on the 3 phases that we know and we have been talking about: phase 1, phase 2, and phase 3. And so what we see, and is basically how we have planned, we have systems that are toggling back and forth right now between phase 2 and phase 3, based on what they're seeing in their local community context. And so if you have additional spread, for instance, in the community, you have systems that might have been fully face-to-face that are toggling back to a hybrid model. And over the course of the semester, we've also seen systems ramp up from 1 to 2 to 3, and that has seemed to work really well. Research that we are seeing alongside our medical experts continues to show that our schools are not super spreader locations, and our local experts with Louisiana Department of Health and Children's Hospital and Ochsner's, we stay in contact with them constantly, and they tell us that our mitigation efforts that we have in place are among the best in the country. And so we are proud of the work that we're doing. We're proud that plane is off the ground, and to all extents possible, if we can all as a community follow what we know makes sense to keep everybody safe, we will hopefully be able to continue to have an educational process that is working to some degree as much as possible to children. The next slide I want to share with the group has to do with our cases, and this is the second slide. So as of November 15th, we have roughly 1,600 faculty and staff members who have tested positive across the state, and we have about 3,500 students who have a positive test across the state. Now, this is from when our schools started, basically, and many of them started the first week of August. So we're 4 months in many cases, and we've had 3,524 students test positive for COVID. Now, one case is too many, but in consideration of the fact that we have over 800,000 kids in our state across 1,700 schools, you know, that number certainly is a reflection of the mitigation efforts that we believe are working in our schools. A couple of additional bits of information. We have worked to develop what we call our Strong Start page, our Strong Start to the school year at our Louisiana Believes website. And on that Strong Start page, we have a host of resources on how systems can help deliver instruction. We also meet frequently with system leaders. In fact, right before this call, I had over 100 system leaders on a call, and we try to keep everyone connected and moving in the same direction. We've been able to secure through private and public partnerships a number of face masks. At the turn of the year, we'll be working to deliver additional PPE to school systems who need that. At this time, working alongside our partners at LDH and the federal government, we are working to deploy 300,000 rapid COVID tests to our schools so that they may have those tests, so that they may work with their local school clinics or community partner clinics to push additional tests for their students and their faculties into those locations, so that we can get results as soon as we can to make important decisions. And so I'll wrap there, Mr. Pearson, but want to thank everyone for their patience with the educational community, for the flexibility that they're showing with the educational community, and we will continue to do our best to deliver safe environments for kids while trying to provide the best education we can through these circumstances. So thank you so much, and I know I'm working alongside a great higher ed commissioner and Dr. Kim Hunter-Reed, and I know she'll come on behind me and certainly inspire you more than I have.
No, that's an important update for us. Thank you for sharing it and the perspective, and certainly pleased to know that the work that we're doing is informative and helpful to you. And then certainly, as you pointed out, with the large universe of students, and to have one case is too many, but still a very low infection rate is certainly impressive. Co-Chair Terry, I don't know if you have anything else that you'd like to add.
No, thank you very much.
All right, we will now then transition to Dr. Reed.
Good morning. Delighted to be with you all this morning, and always great to see my partner in education and Dr. Brumley. Really appreciate, first of all, the governor's comments about the importance of equity of opportunity, and really salute all of you for the great work that you have been doing. And as he said, our work is not finished, continuing to do. And delighted that Regent Perez, who is a great leader on our board, is with us this morning as well. I wanted to give you quick updates on two areas. First, in terms of impact of COVID on higher education in the state. We have, as I believe I've reported in the past, we've seen our four-year institutions have stable enrollment or a slight increase in enrollment. The major hit has been to our community colleges in terms of enrollment decline, and all of the campuses, like our K-12 partners, are working hard to balance education and safety, and trying to do everything we can to promote moving that forward hand in hand for our students. We've gone from about 80% of our educational offerings being traditional, 2% hybrid, and 18% online in 2019. This year, we're about a third in terms of traditional, hybrid, and online courses for our students. Again, trying to make sure that individuals who need to, because of underlying health conditions or preference in terms of consumer competence, that want to continue their education online, have the ability to do so. We, of course, have been continuing to encourage our students to not defer their dreams, to keep moving forward with their enrollment and keep pursuing those important degrees. We have, like Superintendent Brumley, been reporting our positive cases, and thanks to Courtney Phillips and the Department of Health and Office of Public Health partnership. We have information every week reported from every institution regarding faculty and staff positive cases. I believe last report was about 5,700 positive cases. And so we are seeing our campuses do an excellent job in terms of providing leadership and support and safety. But as you all know, we have significant community spread across the state. And so we're trying to encourage students to stay safe. What you'll see in the next week that is different for us in higher education is most of our institutions, public and private, will move online after Thanksgiving, and our students will not report back to campus after the Thanksgiving holidays. They'll complete their studies online, 100% online. And then in the spring, LSU and Southern have already announced collapsing their semester, less days off for large spring breaks, Mardi Gras, things of that sort. So you will see academic calendar changes that try to really condense and focus the academic time and minimize the amount of time off for students to travel back and forth. So that's the report, and basically where we are in terms of student safety and trying to make sure that there's more testing, there's more tracing, there's more waste treatment research, and a very strong partnership. So I'm delighted about that. Co-chairs Sterling and Pearson, if I can, I just want to really briefly mention the phenomenal signing ceremony yesterday with the Atlanta Fed. As you all know, you had the Federal Reserve Bank, Dr. Alex Reuter, present a CLIF tool, really a phenomenal financial planning tool that has been now customized by the Atlanta Fed to allow individuals in poverty who are on public benefits to have the benefit of an analysis that allows them to understand the potential impact of new careers, if you will, and also the impact on their public benefits and when those will fall off, so they can make good informed decisions as they work to move from poverty to prosperity in our state. And we saw the tool because Co-Chair Sterling has served with the Fed as a board member and gave us the opportunity to also have that information shared with our subcommittee, Education Workforce Subcommittee. Fast forward to yesterday, we have signed an agreement with the Atlanta Fed, and they will be customizing a tool for Louisiana based on our public benefits, CLIF, and our public information, so that our state agencies, our workforce, our community agency partners will have these tools to allow good information for case management with individuals, but also for policy conversation as we try to build a more resilient Louisiana. So stay tuned. We'll look forward to, with your permission, co-chairs, we'll look forward to showing off the tool and the training and the support that will be behind the tool to make sure that it is used to move our state forward. But just wanted to thank you all for making us aware of the tool, for connecting us, Terry Sterling, and for making sure that that customized tool is coming to Louisiana soon. So with that, I will stop and see if there are any questions.
Commissioner Reed, I just want to comment, Louisiana has had its own Operation Warp Speed with your dedication and effort for the adoption of that tool. And the bank was certainly, congratulatory and recognized your efforts and that of, workforce development as well as social services to get behind the tool. I know there are a lot of hamsters on that wheel, but your leadership has been extraordinary. And this really is a tangible step when we talk about our report and addressing equity and opportunity. This is really a tangible item that we can check off the list that we believe will be transformative. So thank you for your leadership.
Thank you.
All right. Yes, we're really focused in many lanes right now, but in all of them, to try to leverage all available resources is certainly the most important feature right now. And so this gives us another important tool and another way to accomplish that. And by working together, we're seeing a lot of success. So thank you for your leadership, Dr. Reed. I'm looking for Department of Health. I know that there's a lot of competing meetings and ongoing activities this morning. So I don't know whether. Say again.
I'm on the line, Chairman Pearson. This is Courtney Phillips.
Oh, great.
I'm just listed as someone else right now.
I noticed that Vicki Thomas was here as well, Dr. Phillips. So please, thank you for your assistance today.
No, thank you guys. And thanks for the opportunity to present to the commission today. First of all, thank both you and Chairman Sterling for y'all's leadership of the committee, of the commission, and the support y'all have given to LDH. And also to Dr. Brumley and Dr. Reed. Their entities have been instrumental in their support and communication and efforts as we engage in the fight against COVID. So I do want to appreciate them and the work that they are doing on an ongoing basis and trying to be innovative in terms of how do we continue things going while still being successful in the mitigation efforts. So I want to highlight where we are with COVID and what our numbers look like today, and then where we're going into the Thanksgiving holiday, and then an update in terms of our vaccination. So as many of you know, this past Friday, we had our biggest reporting record where we reported out the largest single day increase of 3,492 cases. And that's been the largest increase since the start of the pandemic in Louisiana. Yesterday, we reported out 2,073 new cases. That brought us to a total of 211,966 cases. Typically, we see that those cases are, from the large part, from the community setting. It usually ranges between 90 to 99% from the community. Yesterday, that report out was 91% of the community. We did have a larger percentage than normal from a particular jail setting. But normally, the last couple of weeks, it's been 95 to 99% from the community. 37% of those cases were from the age category 0 to 29-year-olds. Unfortunately, we did report out 15 new deaths that brought our state for a total of 6,199 lost ones that we've been impacted by COVID in our state. As it relates to our testing, I think you've heard from Dr. Brumley and Dr. Reed that we continue to try to push testing. One of the things Dr. Brumley mentioned and that we're also doing in the higher ed setting is really pushing out some antigen rapid tests, and those are known as the BioNext tests, and trying to get those to key settings to be able to do on-the-spot testing with a quick turnaround, 15 to 20-minute results. Yesterday, we reported out 27,961 new tests. And if you notice on our dashboard, we're also reporting not just the PCR, the typical test that we've been reporting, we've also started adding in the antigen test. And that's the quick turnaround test that we are pushing out to the schools. Thus far, we've tested 359,246 tests this month. for a total of a little over 3.1 million tests conducted and reported in our state. The numbers are not finalized today, but there will be a larger case count as well as test count. Part of that will be a backlog dating back from September from one particular lab. So we'll see an increase of about 70,000 tests conducted from that September to date timeframe from this one particular lab that will be reported out today with a little over 2,000 positive case results. Again, we will retroactive those to the actual date, the appropriate date, but you will see that increase reported out later on today. Unfortunately, as the governor mentioned, we do see our percent positivity across the state increasing. Our statewide percent positivity as of November 11th, again, that's a 7-day average, was at 7.5%. That's an increase from our last November 4th date of 5.86%. So a pretty large jump in 7 days. We see that increase not just on the state average increasing, but we also see that in every region of the state. 55 of our 64 parishes saw an increase in this past week. We had 3 parishes that are above 20% positivity. That's East Carroll, Franklin, and Caldwell Parish. 27 parishes also had a greater than 10% positivity, up from 16 parishes in the previous week. And we have 26 parishes that had a percent positivity ranging between 5 and 9.9%, which is up from 24. So as the governor mentioned, we continue to see an increase across the state, and we have work to do, but we can do it. We can make these efforts. Our hospitalization, as he mentioned, we had a call with all hospital CEOs and CMOs yesterday. And we continue to see our hospitalizations increase. Today, the report out will be an increase of 43 hospitalizations, COVID positive hospitalizations, up to 972. So a continued trend that we see as it relates to that. Also, the number of vented patients that will report out today will be an increase of 13 from yesterday, bringing us to a total of 101 COVID positive patients that are on a ventilator. As we look at cases and where they are in the age groups, as I mentioned, the 0 to 29 population is where we see the largest increase. We see those increases across multiple regions, but we see notable increases in regions 1, regions 4, and region 8. So the greater New Orleans area, the Acadiana area, and the Monroe area is where we see raw number increases in terms of the 18 to 29-year-old increase. Also, in terms of the 5 to 17-year-old increase, we see some of the greater increases in regions 4, the Acadiana area, region 7, Shreveport, and region 8 in the Monroe area. And as with the community increase, you will see a correlating increase in higher ed as well as K through 12. And so we do see those increases, and those entities are working as swiftly as possible and putting those mitigations efforts in place. And they are to be commended for the work that they've done throughout this process. Some other increases that we see that are not limited to community setting are our congregate settings, and particularly in our nursing homes. We see that a little over 40% of our nursing homes have reported new locally acquired resident cases. And this is up tremendously from the previous week. The previous week, we reported out a little over 13% of the nursing homes had a new locally acquired resident case. 24 of our nursing homes have reported 3 or more new cases in this past week, up from 9 nursing homes the previous week. And then 35% of our nursing homes reported new staff cases. And in comparison to last week, that was 31.9%. We continue to see outbreaks in a couple of different settings. Bars, we know this past week, we reported out four new outbreaks in bars for a total of 21 associated cases. The same thing for some of our church outbreaks, 13 associated cases since our November 10th report out. And then we see additional outbreaks as it relates to some of our gyms and industrial settings. We continue to talk about large gatherings, but we also know that it's no longer limited to large gatherings. You all have heard the governor in his press conference and some of the messaging that we've put out, that small events, some of these small family gatherings are having a major impact in terms of spread, and not just to the people that are in attendance. At one of the previous press conferences, the governor talked about, Dr. Cantor talked about a small wedding in Maine, a very small wedding, but the impact throughout that community led to multiple people being positive and over 70 people getting sick. None who actually attended the wedding, but just the spread that occurred. And while we're talking about Maine for that event, we also know that we see the same situation here in Louisiana in terms of small family gathering, friends gathering, and the spread that it extends to multiple people in the community. So the happy hours, the game nights, extended family dinners, baby showers, we do see that uptick here in our state as well. Again, while that is not promising news, we do know that we have the opportunity to get better if we follow the mitigation measures, the masking, the social distancing, and the washing of our hands. Those are key things that we continue to harp on and that we want your help in spreading that message, particularly as we go into the holiday season. I mean, Thanksgiving is a time that we all love to get together. It's a time we want to spend with family and friends. It's the gathering and the love of Louisiana. It's part of what brought me back here to the state in terms of being able to spend family time and gathering with your communities to engage in these type of events. This is not the year to do that. It's the year to do it a little bit different. We encourage everyone to stay within their household members in terms of their events. In the event you do consider adding other non-household members to your event, we ask that you try to keep it as small as possible. Keep it briefer. Consider having an outdoor event with multiple tables where each family is at a separate table. Consider doing the Zoom Thanksgiving. Just be mindful in terms of where we are and what we're facing. Here in Louisiana, fortunately, our weather is still beautiful. Unlike some of our Midwest and Northern counterparts, they don't have the ability to be outdoors and have these type of celebrations. We do, so we should take advantage of that. We know outside is safer, and so we're encouraging folks to do that. For those individuals who have a higher risk for COVID, our older population, individuals with underlying conditions, we are encouraging them to please stay home and celebrate virtual. This is the best thing that we can do at this time. As the governor mentioned, even us digging deep and pulling really, really intentional on our mitigation efforts, it's going to take some time for us to see this turn around. But while everyone is fatigued and tired, it's not the time for us to give up. And we've seen ourselves slack, and we have to dig deep. This is the time. Our hospitals are going to be to the point where they are overwhelmed. In the conversation with the CEOs and CMOs yesterday, they are concerned with their staffing, not necessarily the bed capacity. We have 21% available ICU adult capacity beds right now, but they are going to be concerned with the availability of staffing. And unlike the first and second spike that we saw in Louisiana, where we were able to work with other states and do contracted staff, we won't have that availability. All states are in the same situation that we will be in. We are a little bit behind some of the other states right now. And so those mitigation efforts are critical. You hear a lot of conversation in terms of the vaccine and where we're headed as a nation and the availability of the vaccine coming at the end of the year and early next year. And that's really important. That's a light at the end of the tunnel. But I don't want us to be lost in that conversation of the importance of the mitigation efforts and the bridge we need till we have a proper number uptake of individuals accessing the vaccine. And so as the governor mentioned, we do think that we're probably mid-December to late December that we should at least get a first round from one of the entities from Pfizer. That is likely going to be the first vaccine that's going to be out. You know that there's multiple companies in trials right now, but likely the first two that probably are going to be allocated will be Pfizer and Moderna. This is going to be an important piece in terms of the critical tool of defeating COVID. But we need our partners at the table to make that happen. The first round is going to go to, as the governor mentioned, frontline hospital staff, followed by some of our nursing home staff. And it's all going to depend in terms of the numbers that we receive. There's still a lot of questions in terms of the vaccination and the process. What are the different variables? What are the characteristics of the different variables? The amount of doses received and distribution timeline. We're preparing here. We submitted our draft vaccination plan to CDC. Maybe 2 weeks ago, we received positive feedback. Yesterday, they sent out a scorecard of states. We were one of 5 or 6 states that scored in the green level of the scorecard. We still have work to do, but that was encouraging for us in terms of the work where we are. As the vaccines trials continue, we're working with our federal partners and our hospitals and our folks on the ground to make sure we're prepared to receive those. We're looking at where we're going to map out where the vaccines are distributed, those main sites, working with our tier 1 hospitals. As I mentioned, there's still a lot of unknowns in terms of the vaccines, but we are ready to receive them. We have a rollout plan for the initial allocation. And as we receive more information, we want to make sure that we keep the commission up to speed so that you all have the most up-to-date information. Even if it's not at a meeting on that time frame, we can make sure we push out the appropriate information. Another piece on the vaccine is that HHS is going to be partnering with Walgreens and CVS to offer on-site COVID vaccination services to our individuals in nursing homes and assisted living. And they're going to work on those directly once there's a recommended vaccine for that population. Still at this time, there isn't a vaccination for children. Pfizer has recently received permission to include children 2 to 18 in their trials, but there has not been a vaccine that has been safely tested for children at this point. So the vaccines that we will initially receive, of course, will be for adults. But again, based on the allocation, we will likely for that first round, it will be limited to the hospital personnel who are having direct interaction with COVID positive patients. So again, a lot more to come. But as we are right now, it is really the time for us to dig deep as a state, to follow through the mitigation efforts and to really encourage our loved ones, families, our colleagues to lead and lead by example. For the business leaders on the calls, we would appreciate partnering with you all to help push the message out. We do have, messaging as it relates to Thanksgiving, the holidays, staying safe, social media graphics that we would love to share with this commission that you all can push out to your specific organizations. But really today is a time for us to dig deep, for us to be smarter, stronger as where we're headed in terms of COVID and the efforts of our state. As the governor mentioned, we don't want to go backwards, and we all have the ability to control that. Each one of us has the ability to have an effort and intentionality in terms of where we're going in our state. And so I ask that you help us to spread that message and to do what we need to do in our state to be successful in the fight against COVID. So again, thank you for the opportunity to be here and to share the information. And I hope and wish everyone a safe Thanksgiving. And please help us to follow the mitigation efforts and to do what we need to do as a state. So thank you, Chairman.
Thank you, Dr. Phillips. I have a quick question. Have we given consideration to, much like using Walgreens and CVS to do nursing homes, to take a similar approach to those who really are the culture bearers in New Orleans? How are we going to get it to our musicians and our restaurants and hospitality and our bars? So potentially we go to them rather than they having to find a place. Because I was on a call, and one of the suggestions is that for resiliency in culture and restaurants and those activities, the states that get the greatest adoption of the vaccine will be able to say we're safe and open. Mm-hmm. And so it made me think about, how do we do that? And do we take a similar approach? Your big employers will have partnerships with the auctioneers and the FMOLs and the LCMCs and get their employees when they get to that stage. But how do we target the equality of opportunity on the cultural side and in our restaurant and tourism and musicians?
No, thank you for that. Absolutely. And those are things that our Vaccination Action Collaborative are working through to make sure we do have that equity lens there. What we've been doing and working through as we are in flu season and doing flu vaccination is holding drive-through flu shot clinics as a test run in preparation. So when we do have COVID-19, the vaccine, what does that look like for us to hold these same clinics across the state in multiple sites, similar to what we're doing with our testing strike teams. So we do expect once we get to that particular phase of the vaccination where it's for the general population, what does that look like to have very similar pop-ups in terms of those testing sites, but really vaccination sites. Also working with our chain pharmacies, our independent pharmacies. And so we are working with multiple entities to be able to have them prepared when it is time for those particular populations of how do we get out and about and meet people where they are to make sure we are able to have folks vaccinated who need to be vaccinated in those particular phases. And that's a critical sector in terms of our businesses, our restaurants, our musicians. And so if you all have ideas that we may have not factored in yet, then we can definitely add that into our planning through the Vaccine Action Collaborative. But those discussions are underway.
Thank you.
Anyone else with questions for Dr. Phillips? Thank you so much. That's a great report out. A lot of information there, very timely for us. And again, helps us with relaying those messages around caution and how important compliance is and the warnings about the family gatherings over the holidays. So thank you, and thank you for your partnership and continuing to keep us so well informed.
Thank you. We'll make sure we share our messaging and graphics so you all can push them out to the commission so they can push them out as well.
Really helpful. Thank you.
Thank you guys. Y'all have a wonderful Thanksgiving.
Thank you. You as well.
Workforce Commission.
They deferred.
I think I saw that message from Ava that she'd had something come up.
Yes.
Secretary Robinson, did you want to make any comments relative to either the Unemployment Trust Fund or any other topic? All right. Well, status and update really of our 2.0 document. I believe that it's going to be released any minute now from the governor's press office. It will contain a link to the document, so the entire array of elected officials, of public business leaders, anybody that's going to want to get a great sense of the body of work that we've put together. I think it's 38 pages. We tried to distill down the, as you know, the very lengthy task force reports that were in the neighborhood of 500 pages when you stacked them all up, gathering the themes and important messages. Not to say that we've got all of them encapsulated in the report. That was a big part of our challenge, was to make sure we got all the high points, and then for those that want to get into more specifics, more detail, the appendix will also be linked there and available, and the information will also be posted at the opportunitylouisiana.com website under the associated site there for the Resilient Louisiana Commission. So that goes live for us today to share. We've distributed it to the commission members for their final comments perhaps 2 weeks ago, and we briefed the governor. He's provided that also to his policy staff, so that again, he's making a strong effort to secure all the recommendations and as quickly as possible be able to go to implementation, and also give consideration to which ones may need legislation or other elements such as that. So Terry, what additional would you like to lend to this?
Yes, and so congratulations to the entire commission on finally, getting the report off the deck, and really excited about it. I think we have a two-step process. One, we discussed initially that there were things that we left on the side. We didn't put in the arts, we didn't put in climate change, even though we went back at the end, and there's a piece at the very end of the report as it relates to climate. But the one piece that the pandemic has continued to highlight are the challenges around housing. And so Don and I had some discussion, and the recommendation for this, for the commission's consideration is there a small group of interested individuals that might be interested in really reaching back to Anika Morris and others and having some conversation, both in the administration with their experts and others, to put a group together that might bring forth some recommendations as it relates to housing and the housing crisis. And then second step is, how do we organize ourselves as we get to the first of the year around, are there things in the report that we specifically want to get behind and, support the governor with legislation, or things that we want to do with other communities and businesses. And so those are the two kind of next steps that we've discussed and would like to hear back from the commissioners in regards to your interest in next steps.
And I can report to you now that the governor just did release that information with a media release from the office of the governor.
Thank you.
Other comments relative to our comprehensive game plan release? Anything from the commission at this time? All right, then we can entertain any other business if there's items that individuals wish to bring forward. Tyron, did you have something?
No, sir.
All right, David, I think you've been possibly monitoring anything coming to us from YouTube. Any other comments or concerns from the public that you want to relay to the commission?
No, sir, there have not been any.
All right, any other comments for the good of the group? If not, we will entertain a motion to adjourn.
So
I'll
move.
move.
All right, everyone. Thank you so much for carving out some time for us today. All your participation along the way. You heard the governor say today, our work is not complete. That's an invitation from Terry and others to send us an email if you wish to participate in this endeavor to look at housing related issues. And again, we're watching the spike. We're going to have to circle back and get an update in the coming weeks from Dr. Phillips and others, and we'll continue to pass information along to you as we gain it. Thank you for your time and attention today.
Thanks, everyone. Have a safe holiday.
Thanks.
Compliance. All right.
Commitment.
Bye now.
Bye-bye.